get in. And probably people have heard enough too at this point about CEUs that they're getting close to remembering how to do that for each session for those who want to do that, right?
You've been doing a great job.
Thanks. I feel much better about the last session. The first one was stressful. Just even getting into everything was not smooth as I had hoped.
Practice helps.
Do any of you have time lag from video and audio?
A little bit at times.
Yeah, mine is like Justin was off a good beat for me. And I'm off right now from when I'm waving my hands around to when you see them.
Okay, here we go. Welcome, everybody. We're gonna wait just a few minutes to give people a chance to join us. I just want to make sure that you find yourself in the workshop, the track you want to be in. This one is a continuation of the 2 earlier tracks on Bridges to Care. This one is specifically about training and evaluating the impact of Bridges to Care. And I'll tell you a little bit in a minute about our presenters again, but we're just gonna wait a couple. I hear thunder, and Geri tells us that it's raining at her place. It's not raining here yet, but this is exciting. We can use some rain in San Antonio. I don't know about Ohio, or I don't know about Oregon. I don't know about, we've got people coming from all over, Carolinas, and so I'm not sure who all needs rain, but we certainly need rain in San Antonio. And we wouldn't have thought that from this spring. We had lots of rain this spring, which was really left us green for a long time. It was nice. See, I grew up in a farm. You can always talk about the weather, right? And people wonder, there's a big, storm coming our direction to the Gulf. We'll see what happens with that. Whether it becomes large. I'm not going to say the H word that goes with that, because it's been a bit since we had one of those. So that's kind of nice. One more minute. And I still see people are, popping in, so that's good.
How many participants did we have in the other 2 sessions?
The first one was 78, and the last one was 60. So I think we'll go ahead and get started. Yeah, it's been great. So again, welcome to the 6th Annual Pathways to Hope Conference. Good afternoon. My name is Helmke, and I'm the Faith Liaison with the City of San Antonio, but I'll also be the session moderator today. Some folks have already been doing that, but please share your first name and zip code and any speaker-specific questions and comments in the Q&A box. I just found out between the last session and this session, that's the preferred communication, the official communication spot, the Q&A. We've been kind of working both of those in these tracks, but if you can put your first name and zip code and any speaker-specific questions and comments in the Q&A, that would be great. Again, welcome to everybody, and let's get started with just a little housekeeping. If you're attending this conference to receive continued education units or CEUs, please listen carefully. All registered attendees seeking CEUs must remain in the session for the entire duration. These sessions are approximately 75 minutes long, so 1.25 CEUs will be issued upon approval, and in the areas of LPC, LMFT, social workers, and psychologists. Each attendee can qualify for a total of 4 CEU eligible workshops Friday through Saturday. A post-session survey is required, as well as a daily conference evaluation. For those joining outside of this state, please follow our CEU instructions, but it will be your responsibility to seek final approval from your state's credentialing board. We're grateful to have the support of NAMI Texas and the Bexar County Recast Project for making these CEUs available. Again, all registered attendees seeking CEUs must remain in the session for the entire duration. So now it's my pleasure. I'm going to introduce both of our presenters. And the first that we already see on the screen is a dear friend, Geri Gregory. She's the project coordinator for Bridges to Care San Antonio. After a 36-year career in congregational life and community organizing, volunteer and programs management, along with communications and graphic design, Geri joined Bridges to Care San Antonio at its origin on October 1, 2020. And she's so proud to bring her talents, and I'm even maybe more proud that she said yes to helping this organization. I tried to steal her away from her previous job, I don't know how many times, because she's just done just fabulous work for San Antonio over those now 37 years of that type of contribution. I'm also going to go ahead and introduce my other good friend, Susan, who will be presenting in the second portion of this particular workshop. Susan Korbel, Dr. Korbel. Some people, Susan, by the way, have been calling me doctor in these, and so I've had to correct them. Anyway, so Susan is officially a doctor. So Dr. Korbel has been behind the scenes, really helping some of the most premier South Texas businesses chart successful courses with strategic and tactical planning. Her company, Core Research, conducts consumer, audience, employee, voter, business-to-business research and community assessments. Susan has dedicated her research to learning how communications function between the source and the receiver, and how information is best conveyed, whether through personal conversations or mass media. So Susan has really stepped up into this kind of community, or she still does that work, but she's really brought a strong gift into Bridges to Care and helping us to learn from what we're doing, seeing if it has impact. And we'll be hearing from her during the second portion of this workshop. I'm going to go back to sharing the screen and just give a small overview of Bridges to Care in case you weren't in a previous workshop. But Bridges to Care San Antonio began almost exactly a year ago. There was a meeting at the end of the Pathways to Hope conference on August 22nd, and today is the 27th. So you can see it's even a little bit more than a year. And right afterwards, we decided, let's go. And NAMI San Antonio and the City of San Antonio's faith-based initiative, which I lead, we worked together as quickly as we could. And we kicked off this whole project in less than a month on October 1st last year. Basically, Bridges to Care is the pulling together of congregations in cohorts that are in geographical proximity with each other. And then they start working together, all of that undergirded by 20 plus hours of training, which is what you're going to be hearing about in this particular session. And so that's the basic, but it's about creating and net weaving community together. In our previous sessions, just as a review, and these are all going to be on YouTube. So if you didn't go to the first track or second track, you can watch those once those are posted on the Pathways website. But the first track this morning was how to develop those congregational cohorts, the importance of leadership, how wellness champions come about, and that this is all about relationship. It's relational, not transactional. The second track, which we just finished a couple minutes ago, was about resourcing. How do we access resources that are needed in this area of concern? Assessing needs, the movement of it, developing partnership, I can't read this, I should be able to know this off the top of my head, right? Integrating the work with community, how it was organized, ongoing conversations. And so this then leads us to what's the training about and how do we look at what's being done and if that's helping, if it's working, what are we learning from it? So now I'm going to lob it over to Geri, and I'm going to go to the next slide. Is that okay, Geri?
That's great. Hi, everybody. Thank you for being here with us. As Ann said, I hope you were able to attend the first two sessions, and if you weren't, I hope you're able to watch them afterwards. And I'm here to tell you about the training. You can see the 5 core modules that we have listed here, but I want to also say that Bridges to Care is a training organization, but it's so much more than that. Training is where you start. And we form cohorts, and there's so much more than training, and there's so much more after training. But we start our training with a companionship module, and I consider that to be the core of Bridges to Care San Antonio, because we're learning how to walk alongside someone who has mental health concerns. You don't walk in front of them, you don't lead them, you don't walk behind them to push them, you walk alongside them so that you can hold their hands, you can help them navigate through whatever mental health concerns they're having. And you're also helping the family of that individual. So there are lots of reasons we start with companionship. And that's a 4-hour session. And right now we have several trainers, but for the month of September, Reverend Jermaine Alberty is giving that companionship module. And then we go into becoming a trauma-informed organization or congregation. What I didn't know before I started this training is that almost everybody, if not everybody, has experienced some sort of trauma in their lives. And how do you deal with that? How does anybody know how to deal with it? I really didn't even know how to define what a trauma was before I had this training. And I also wanted to reiterate what both Reverend Veron and Reverend Justin had said in their sessions, is that you don't have to be a mental health professional to take the training. You really just have to have an open heart and an open mind and just want to help people. So becoming a trauma-informed organization or congregation, that module is given by the Ecumenical Center of San Antonio. And currently all of our training sessions are given via Zoom because we're in the pandemic right now. We've talked extensively about going in person, and we would love to go to in-person training, but just not quite yet. After becoming a trauma-informed congregation, we go to mental health first aid, which is a nationally credited course, and you can receive CEUs for taking that course. It sounds daunting when you see that it's 6.5 hours long, plus 2 hours of pre-online coursework. But really that 6.5 hours goes quickly. That course is given by the Center for Healthcare Services here in our own city. Again, it's also on Zoom. And you think about, oh my gosh, sitting in front of a Zoom screen for 6.5 hours. They really are good trainers. They're experienced trainers. They make it fun. They have contests when you're going through there. They have a scavenger hunt. Sometimes they give away prizes. So it's really not as daunting as it sounds. It's a great learning experience, and it's fun too. After mental health first aid, we have suicide prevention. And that's so important as we read more and more stories in our news about people who have, we don't say the word committed suicide, we say those who have tried to harm themselves or tried to end their lives. that particular module is offered also by the Ecumenical Center here in San Antonio. And then we end our training modules with how to build a program in your organization or faith community. And again, Reverend Jermaine Alberti gives that particular module. He's well versed in it. And we also have training on sacred.org. If you were in other sessions, you know that sacred.org is the San Antonio Community Resource Directory. And San Antonio is so lucky to have sacred.org. I wish every city had their own version of sacred.org. But we're so lucky to have Bill Neely. He's on this Zoom, and the rest of, it's www.sacred.org. Bill Neely and the rest of his team do an excellent job of keeping it up to date, keeping it well resourced. And I believe it's over 6,000 programs now that are listed on sacred.org. Is that correct, Bill? And we also have added, starting in September, yes, it's over 6,000 programs now listed. And all of those programs are free of charge. On sacred.org, they don't list programs that charge the people coming to look for their resources. And then we've also added NAMI to the September, he says about 1,000 with mental health components. That's great. They have developed a new mental health portal that will be out in the next couple of weeks that concentrates only on mental health resources. And it's such a big boon to our city and to Bridges to Care. We're so grateful to sacred.org for doing that. And NAMI, National Alliance on Mental Illness, also has great resources in the area of support groups and extra training. And after a wellness champion or an individual goes through these trainings, we offer additional trainings, most of them free of charge. And I'm the one that you get a million emails from telling you about all these trainings, both the Bridges to Care training and the after trainings. And once you are signed on to Bridges to Care, you have to get used to getting emails from me because I send at least one a week, sometimes more than one a week, with a lot of detailed information. If you have any questions about the training, please put them in the Q&A. Did you want to pause now? Anne, were there any questions in there? You're muted. We couldn't hear you.
It says I am muted. Okay. No, I think I've got those covered. Would you like me to go to the next slide?
That'll be fine.
Okay.
So there is a process to going through Bridges to Care. The buck stops right here. I started from day one, and it's, I just have to tell you a story about that. And that is that my career in congregational life had ended on September 30th. And I called Ann up on sometime in the summertime. I knew my congregational career was going to end then. And I called her up, and she had said, while she was introducing me, she told you that she tried to hire me away several times. So my natural first thing to do was to call Ann. And I said, I think we need to work together after all these years. And it just happened that they were talking about Bridges to Care. It's right up the way that my mind works and the way that my heart and passion goes. Really wanted to help people and do something that was worthwhile in the community. And so it just kind of all fell into place. I called at the exact right time, at the exact person who is putting it together. And so it's amazing. It was like it was meant to be. And so I am the one that usually calls people or congregations. I usually get lots of emails, phone calls from people that say to me, oh, you should call this congregation, or hey, you need to talk to this pastor at this congregation about Bridges to Care. So I usually talk to the senior clergy of whatever congregation I'm calling, and we talk about Bridges to Care. I tell him or her about what Bridges to Care can do, just like you've heard in the earlier sessions. And basically, I'm selling them on the idea of bringing Bridges to Care to their organization or to their congregation. It's really not a hard sell, because how can you lose out? It's a free training. And the only cost, as Justin said in his session, is time. The training is about 20 hours. The cohorts are formed sometimes before we even start training, sometimes after we start training. But the next thing that happens is that the trainees are chosen by the senior clergy or whoever is the point of contact for that congregation or organization. And I often advise people that are choosing their wellness champions to choose people that not necessarily have a mental health background, but just simply have open hearts and open minds. Maybe maybe the person that you need to choose is the usher in your congregation. They like to greet people. They see people all the time as they're greeting them. Maybe they would be a great wellness champion. Or maybe it's the person that's working the food pantry for your congregation or organization, because they're seeing people in need all the time. And what better way to enhance their job, their volunteer job, than by going through Bridges to Care training. We have in place, because it is a technology heavy process right now, we soon learned, once we started training, that there was a big learning curve. There were a lot of people that had never used Zoom before. They didn't really know how to log on. So we instituted, thanks to Reverend Veron Blue, the Bridge Buddies. And what that is it's an individual or group of individuals that have been through training already, and they walk through training with those currently going through training to help it make it easier. Like the mental health first aid module, it's a different, because it's so long and because it's a national certification, it has a different way of getting online. And that's confusing to a lot of people. So the Bridge Buddies are there to help our wellness champions get through the training, and also to remind them that they have a training coming up. So that's a really big idea that Reverend Veron had that really has helped us scoot through the process of training in a much easier fashion. So you've already heard from Reverend Veron and Reverend Justin about how important it is to develop relationships within your cohort, within the area of your own congregation. I mean, some of the wellness champions, even though they go to the same congregation, may not necessarily know one another, but we're all learning to work together, and also to have relationships with the individuals that need mental health care and need you to navigate their mental health care with them. We have resources that, like I said before, that we give to our wellness champions after they finish training. We even have access right now to a mental health coach training that, while not offered by Bridges to Care, we offer that to individuals going through Bridges to Care if they would like to take part in that. It's a Christian based counseling effort. And if you've we have a question that asked if you've already taken the mental health first aid, you don't have to take it again. If you can produce your certificate, excuse me, we honor that certificate, and you don't have to take it again. Excuse me, I need to cough for just a minute. I'm going to mute.
I don't know about anybody else, but it is pouring at my house. Weather update. Lightning, thunder, pouring. Let's hope the internet like holds, right? So back to you, Geri. Are you okay, Geri? It's not allowing you to unmute yourself.
No.
There, I just did it.
Okay.
I didn't know I had the power.
Okay, thank you. That was a minute of panic. Sorry. Okay, so yes, it's lightning and thundering, and it's actually hailing where I am, and I'm hoping my skylight doesn't fall in like it did for me one time. Anyway, I was talking about the mental health coaching training that we give you notification about, and we will do that for most of the behavioral health network organizations around town. They offer training. We pass that offer on to you, and it's ongoing. Once you get past training, your relationship has not ended with Bridges to Care. It continues. In fact, when you sign the covenant, when your organization or congregation signs our Bridges to Care covenant, you're committing to a 3-year relationship. Now, the wellness champions do not have to commit to 3 years. We know that life happens, but each organization or congregation, we're asking to commit to at least 3 years, so that we know by giving you this training, it will be put to good use, and that we will be able to be with you, and we will walk through Bridges to Care hand in hand with you, and we're here to help in every way possible. I think that pretty much covers the process. Are there any questions?
Let's see what's in the Q&A real quick. Are you only taking mental health first aid for adults? What about the youth version? Did you already cover that, Geri?
I did not. That's a really good question. Well, it happens that I just happened to ask the Center for Healthcare Services last month about the youth mental health first aid. Because of Susan's process of evaluating and assessing what people want after the Bridges to Care training, we learned that high on the list was mental health issues for youth. And so we are offering in September for the first time mental health first aid for youth, but it's only to people that have been through our whole training process. That's not considered part of the Bridges to Care training quite yet, but we are offering it to those that have already gone through the whole process on a first come, first served basis. And our plan is to offer it every month, one session every month with a maximum of 30 people taking it, as long as people still want to take it. So the Center for Healthcare Service has been very gracious in offering that to us, and I'm glad we can listen to our wellness champions and provide what it is that they do want. Any other questions?
Let me see. I don't see any. So I'm sure there will be more.
Sure.
So thanks, Geri. Susan, are you ready?
I am. Can you hear me?
Yes, we can.
Okay. My screen is frozen, so I have no idea. Oh, here we are. Let me tell you a little bit about why I'm involved. You start a new idea, you embrace the people around you, and you're very busy, and everybody's focused, and you seldom have time to step back and just see how we're doing. And so are we seeing our impact clearly, or is our evaluation clouded by our own bias or enthusiasm? That's not bad, but it's also not enough. Anybody who hopes to have a sponsor or some kind of support from the outside, they often say, well, is it working? So someone needs to be able to step outside the wellness circle and see the full picture. Now, unfortunately, when you make yourself one of those people, you're not the most popular sometimes, because what you're doing is telling people the truth about how it looks on the outside. So what we did was we set up a pre and a post training. Can you hear me?
Yes, we can.
Okay,
Just keep going.
I heard another voice in there.
That's okay. We're good.
And the pre-training is basically, who are you? What are you interested in? And what are you concerned about? And the post-training is, did this help? And do you want to learn something more? And what do you want to learn? Kind of simple, right? But it's a survey. Who likes surveys? Nobody likes surveys, except for me, and that's my business. But honestly, a lot of people filled it out for us, because I guess the people who were chosen to be wellness champions, like Geri said, they're the kind of people who like to meet people. And so we also do an informal process of evaluation where we're looking at things like attendance, and if somebody's dropped out, and just in general, how are they feeling? What are they saying to each other? What are they saying, not necessarily to us, but to people in other quarters? And so we listen to stories, and we listen to the kind of commitment they have. Can you change slides, please, Anne?
You bet. Done.
So, so far, we've had 144 participants who have completed the pre-assessment survey before they started in 3 of the cohorts. Now, we started this, I came in on the jump. And so the first cohort did not have an opportunity to do the pre-assessment because they were already in it. And we didn't want to take a snapshot while they were running down the field. But of the 144 participants, 62% were congregation or faith community members, and 29% were clergy, and then 9% were the congregation faith community staff. Can you change the slide, please?
I did.
I have a feeling at my office there's a lot of electricity in there because I'm not seeing anything.
Well, we do, so just trust us.
Got it. Pre-assessment.
Okay, pre-assessment.
So when they started the training, we asked them some questions, and they said yes to, 59% said, are you or a family member or friend of someone experiencing mental illness or substance use? So what we saw is that coming into the program, almost 60% personally were experiencing mental illness or substance use issues within their household or their immediate circle. Almost 50% said, do you feel equipped to be helpful when encouraging people? So half said, yeah, I can be helpful. So that's great. We have another 51% who are going, no, I'm not ready. I don't know how to help. And we really appreciated their honesty during this. And then have you felt comfortable sharing with your family or friend mental illness challenges with others? This is an important one. We have over half who've said, yes, I'll share some of those stories, because as we were saying, stories are the most important part of this. People don't want to relate to statistics. I know that. We all know that. People relate to stories. When you read the newspaper, I know I got hooked on the New York Times when, I saw the first paragraph was a story. It's always about humans. And so if we're going to reach out, we need to be able to be comfortable sharing our own personal stories. And because Geri shared, I'll share mine. Through the pandemic, I was feeling very lonely, and I was feeling like I wasn't helping anybody, which makes me human. So I also reached out to Anne. Anne seems to be the kind of person who makes sure that we all have a home somewhere. And now, Anne, could you go to the next slide, please? Okay. So then we did the post assessment. Now, we're still in the process of just getting our wheels off the ground. So we don't have a lot of people who've completed the whole process and have filled out the post assessment. So we have 37 people who have filled it out. And we asked the same question: do you feel equipped to be helpful when encouraging persons with mental health or substance abuse issues? And it went from 49% to 87%. Now, again, anybody who knows statistics knows that 37 people isn't enough to make a surefire evaluation. But I think that looks very promising. We also asked people, do you recommend this training for other members of your faith community? This was in the post, so after they'd been through it, would you recommend it? And almost everyone said, yes, I would. That's 97%. Anne, could you go to the next slide, please?
I'm going to take a little privilege here because Susan mentioned that, people, statistics, people don't like statistics or whatever, however you said that, Susan, but it's the stories that speak. Well, I'm just going to say numbers also talk. So, the message here, right, is, do you feel equipped? That's the story, to be helpful. But when it moves from 49 to 87%, that tells us that people pre then post feel more equipped to do so. So the numbers do tell us something, no matter when we hear them. It could just as easily have told us the other direction, right? And so that would tell us something. So, and I know too, from working with the faith community as long as I have, that, we tend to be more comfortable when people are not numbers. That said a lot in, the faith. People are not numbers. We're not counting stuff, right? People are not numbers. They're humans. We need to hear their story. But I don't know of very many people of faith who don't also look at the numbers and go, oh, well, look at that. So they do speak. They tell us something. And I'm just ever so grateful that Susan's doing this work. And now I will go to the next slide. My point of privilege.
Okay, so just summarizing that piece of what I've been talking about, familiarity is important because when you're learning something, you're becoming more familiar with the process and the people around you, and you're feeling more comfortable. And so attendance shows us whether or not we have achieved the goal of continuing the process. So we look very carefully at that. And then looking at the needs themselves is important. Now, everybody is different. Everybody has different stories, but we need to know what we know and what we don't know, and then how can we become comfortable? So we asked some specific questions, and Anne, if you could go to the next slide, which could take a while for me.
Yeah.
Okay. We asked a question, and this is in the pre-assessment. Here are some situations that some people find distressing. Please identify your level of distress if, and then they were given high, medium, low, or not sure. So what I've done is I've ranked them in terms of the percentage that said they had a high level of distress if a child tells you of abuse by a relative. That was 64% said they have a high level of distress with that, and 21% had a medium level of distress. 56% said a friend was thinking about suicide. And then it goes down, and I don't know if you can read it if it's too small, but I'll read them to you. Then in order was provide support for family dealing with mental illness and substance abuse. And then 20% said someone experiencing homelessness walked into your business or service. And then the next one, 16% said they would have a high level of distress if someone was sleeping as they walked down the street. You can see that a lot of people are starting to say they have a low level of distress on some of these, like 48% said so. Then someone talking loudly to themselves, 18% said they had a high, 39% said they had a low. And then provide a referral to get counseling or therapy, that was 11% to 58%. Remember, we were asking them in the beginning, do you feel comfortable referring or helping someone? So here's where you see people, well, maybe, not so sure. And then someone approached you, asked for money, and that was 7%. So basically, we have a group that's, you can tell, charitable. We have a group that does have great distress for some issues. And so we needed to know that upfront ahead of time so that then we could communicate that to the trainers and to the members of the cohort. Anne, could you go through the next slide, please?
Done.
Thank you.
You're back.
So here are the top future training needs. Geri mentioned that because of this research, we've looked at opportunities for children's mental health. Because as you see, the top three that came out, trauma-informed congregation, when they said, please indicate your level of interest in the following trainings for your congregation or faith community. So you got 88% trauma-informed congregation. Please give us more. Families coping with mental health. I'm sorry, I'm using MH for mental health. 85%, and tied with that is children's mental health. So those are essentially the same issues where we're coping with multi-age families and then looking specifically at the children. And then a mental health 101 came down a little bit lower. Perhaps they just needed a refresher or what it is that they're ready to teach other people. Companionship was at 73%. These are all very high numbers because these are people motivated to continue. So while we were talking about attendance, but also commitment, you can see that the people who have completed the program show a great deal of commitment in many of these in getting more trained. So they didn't come out of it like, you know, school is out and we're gonna learn any more. We know plenty. These are committed people who have said, now I'm ready to walk further. Mental health first aid came in also at 70%. And then firsthand accounts, substance use disorder, which is interesting to me. I did not expect substance use disorder to be so low. It could be because of my general circle and the kind of public acknowledgement about where substance abuse is. Or perhaps they already got the kind of training they needed during our sessions. And then setting up a mental health ministry. Now this probably, it's interesting that there's 52% who said setting up a mental health ministry when they were already in a cohort. So maybe they're thinking of growing it, which is even more exciting. So this is just an indication of the kind of things we've been asking. And I think if you want to tell me any questions that have come up, unfortunately, the way my screen is working, I'm seeing a lot of strange things coming up that I don't know if they apply to me, a lot from Bill. And so maybe, Anne, if you could filter through anything that people need to know from me, otherwise I'll turn it back to you.
Okay. I don't know what you're getting from Bill because I'm not seeing anything on Q&A or chat. And
Okay.
I don't know if it's the weather, right? Or there's just hasn't been anything. I'm not sure, right? So I'm just going to re-invite everybody to enter things in Q&A. If you have comments, questions, thoughts, I'm going to look at this slide real quick, and you might want to jot these down, but we're going to keep moving. But if you have more questions, later and want to know more about the training, for example, you can contact Geri. She is the overall coordinator, though, for Bridges to Care, so you can always contact her with questions. Questions with Susan and how we're working at this. We are looking at, and maybe that's where we'll go next. So Susan can start thinking about that, but we are looking then, how do we actually measure the impact in community? So that's Susan, I'm going to lob to you in a minute. And of course, if you have any questions about how this all works with the city of San Antonio, you can always contact me. So Susan, do you want to talk a little bit about what we've been talking about, thinking about in terms of measuring the impact in community as opposed to with the internal aspect of what we're doing?
Sure, it's a very slippery slope here because we want to be private when we're talking about issues that involve people's personal lives and their mental health. We are very concerned about protecting people when they're not strong. And so how do we go out and report? We've had X number of people that have needed help, and we have been able to move them through a system. We know that the government, it has many ways of providing statistics. The police department has many ways of providing statistics. And so I would assume that the best thing to do in the long run is to take the aggregate information that we're presented with that come from hospitals, that come from police, that come from social workers, and watch the trend lines over time for our particular areas of town. That is not necessarily something that is easy to do, but it's something that, as I was talking about, it's better started up front so that you're collecting data before you start the process. Then you can look at a trend line. It's very hard when you get to the end of it to look back and go, well, that was successful, when you're looking at a large community. So you have to decide up front, what is my scope of influence? So if it's 5 zip codes, if it's a city council district, if it's the county commissioner district, certainly you don't want to start with the state of Texas, but you start with something that you think you can make a difference about, and then you look at those measurements down the way.
We also have a question. Do you use a standardized program for trauma-informed congregation training or suicide prevention training? And I was answering that a little bit, but I'm going to lob that to Geri. And I'm wondering, Robert asked it. In the first part, he says trauma-informed congregation. And then the second part is suicide prevention training. And I'm wondering, Robert, is that also particular to a congregation? So I'm going to continue what I'm writing, and we'll see how it compares to what Geri says. So Geri, how would you answer that? Do we have a standardized program for trauma-informed congregation training? Are you able to unmute yourself? I just did. I don't know why it's doing that, but
Okay.
We're good.
Sure. So you're asking if what we offered is the standardized, or if it's tailored to what we're looking at. Is that correct?
It sounds like what he's asking.
Okay. Because we are able to have good contact with our trainers, we are able to tailor the training. For instance, we've had a lot of congregations come through, and we're opening it up to organizations as well. But because we have been focused on faith communities, for instance, trauma-informed care is becoming a trauma-informed congregation, becoming a trauma-informed organization. And so it does speak directly to where our trainees are. The last module we offer, building a program in your faith or spiritual community, it talks directly to to us, and that module was created specifically for us by Reverend Jermaine Alberty. So we're lucky. The only one that's standardized really is mental health first aid, because that's a national module. And because it offers national CEUs, there are certain requirements, and that does have to be standardized, but all the rest are particular to us and to San Antonio, basically.
Geri, can you see the Q&A? Can you bring that up? Robert's kind of talking with us. For example, the trauma-informed care, in trauma-informed care, there's a risking connections and faith communities training. I don't know if I knew that, Robert. When you say for trauma, where is that information? That risking connections and faith communities? Can you provide us a link or something? That would be good for everybody. There's also for suicide prevention, there's a question, persuade, refer training. Question first, persuade, and then refer. Robert, if you have any like links on that, that would be helpful to everybody. And that's also how Bridges works. You know, there's just a lot of connecting. We're trying to find the best material possible. And we're also, you know, continually adapting for what's needed and what's being asked for. So Robert, if you could provide that in the Q&A, we would all benefit. So thank you for asking those and giving us that information, right, Geri? That's pretty cool.
Right, we learn as we go, yeah.
It's a Sidrun Institute 12-hour trauma-informed congregations training. We use it in Chicago Trauma-Informed Congregation Network. Well, hot diggity dog. Yeah. Robert, again, if you can get a link, otherwise we're really good at Googling and, you know, finding stuff, but thank you. That's so good to know.
That's why sharing is important.
Yeah. Or my 4-year-old grandson would say, sharing is a good thing.
Yeah.
It really is. So thank you. Thank you. That is so good. Should have known that came from Chicago. Here's something interesting in chat. In North Texas, we have started a Rotary cause-based club focused on suicide prevention and brain health that is not limited by geography, that includes faith communities participation. We have a diverse membership across 4 states, which offer free mental health first aid training. That is so exciting. Maybe we should look at partnering with Rotary. We have a really strong Rotary system in San Antonio. Yeah. So everybody's seeing exactly how this all works. This is really exciting.
Well, that's why we're all here, to learn from each other.
Mm-hmm. Let's see what else. I'm so busy writing things down. Sorry.
Writing it down, Ann.
Yeah, good. We don't want to lose any good information. He sent us a link. Thank you so much, Robert. faithhealthtransformation.org. Health topics, trauma and resilience, risking connection in faith communities.
Got it.
Jesse also writes, somebody else had noted earlier that they're both in a faith community, but deal with substance abuse as well. Jesse Diaz is noting that he's not part of a cohort yet. They live in the county, and he works with a nonprofit for special needs adults. Jesse, we need you. We need to connect. And so if you would put into chat your email address, and maybe, do you have a name for that nonprofit? If you'd put that into chat, Geri will make note of that, and we'll make sure that, you know, we get connected and get you connected to a cohort, or at least the training or something. It says here, surely we will be collaborating with other Rotary clubs across the nation world as well as multiple nonprofits, and invite you all to join us as partners. Well, okay, Shirley, if we have to twist our arm, how do we do that, Shirley? For anybody who's reading and listening to this. There's also from Kara Smith, we have some staff at Endeavors in San Antonio that could also provide some free suicide prevention training. So Kara, can you put in your email address again for Geri? And I will try to remember to copy this, but ways that we can connect with you, that would be wonderful with Endeavors. If we could make that connection for suicide training. We're also trying to build, this is part of the organizational process. We're also trying to build with the trainings, more people to train. Because it's moving quickly, we don't also want to wear out our trainers, right? And so and it's also going to just build more of that in community. So if there are other trainings out there that we could partner with, that would strengthen us, strengthen all of us, both directions, but also even people who might be interested in learning the training. So we know from past experiences that people, when they go through things like this kind of development, some of them do want to become trainers. So if you want to put that in chat, if you know of trainings that are available that we've been doing that would be helpful, that'd be good. If you might be interested in doing some of the training, that would be good too. Look at this, we've got some stuff here. There's a contact, did you get that, Geri, from SW Brain Health? Good. And you got Kara's from Endeavors for Suicide. Oh, and there's Jesse. His nonprofit is Texas Foundation of Hope. And the ministry is Harvest Time Ministry. Great. We need to make that connection, Jesse. You'll be hearing from us. Oh. Let's see what else we have in Q&A. And let's also check what time it is. It's 3:26. We've got nice time. We have until 3:45, so we're good. Robert's put into there the qprinstitute.com for the question, persuade, refer. And then Robert also, the Trauma Informed Congregations Network. This is so good. I bet Verone, if she's listening, is just like eating this up.
Yeah.
Here's one question. Apologies if I missed this. I had to leave for a moment to take care of something. How accessible or applicable do you all think the Bridges to Care training as it currently exists would be to churches outside of Bexar County, but in nearby regions of South Central Texas? How accessible or applicable? Really accessible and very applicable. We do have some folks from other places who are very much interested in this. And we are more than wanting to share that with others, even on, because that's how it got started here. You know, Jermaine from St. Louis has been such a great partner in kind of leading us and helping us to find our own space. You know, we won't be able to coordinate bridges in other cities or communities. We're set up for San Antonio, but in terms of, you know, sharing what we got and how we know and encouraging you, and we're there, right, Geri?
Absolutely. And I do want to add that we are in Bexar County. So even if you're not really in the city, like you're in Castle Hills or Alamo Heights or you're in Bulverde, and you're still in Bexar County, you're included in Bridges to Care San Antonio.
I hope, Laura, that answers your question. If not, if you have some more, please put it in the Q&A. And we'll keep talking till we get it, right?
Absolutely.
How does your suicide prevention training compare to that of the AFSP Talk Saves Lives training modules, which is nationally available? So Shirley, I am not familiar with that. Are you, Geri?
No, I'm not. I'm not a professional.
Yeah, what is AFSP? So Shirley, maybe you can send us that as well. Shirley, maybe you've told us, where are you at on the planet? And would you, if you're in San Antonio, you want to be on the Behavioral Health Network? She's bringing some really good stuff here. I'm just like, what is all this? If Doug were here, he might know some of these things, because he's got a lot of stuff in his head that he, more than generously shares with us. It's just that his head's not here. American Foundation for Suicide Prevention. Thank you, Shirley. We're going to put that down to explore.
Yep.
She lives in Mesquite. We have chapters in our area, so we need to check on that. Thank you, Shirley. What can we do to help you? You seem to be helping us a lot. Can we do something to help you? Collaborate. You bet. Do you have any ideas how we should collaborate with you, Shirley?
I would personally like to encourage Shirley to join in our focus groups with the mental health portal that we're putting together with sacred.org.
So if Shirley were open to doing that, she could contact you, yes, Susan?
Yes, and there's my email on the screen. We have held 4 focus groups so far, and with navigators. We've held them with Bridges to Care wellness champions, and we've held it with some heads of organizations. And so we're looking for one more focus group to see how it could work for both navigators as well as individuals in need. So Shirley, find me.
And if others were interested, would they contact you too?
Yes.
See what that's like?
Our focus groups are painless. Well, relatively. It's an hour long, and we will give you a few scenarios for you to navigate through the portal. We're thinking, as Bill has mentioned earlier, that we're going to launch it in about 2 weeks. So any focus group that we do would be very soon. Ron said the focus groups are fun. Yes, she came back for a second one, as a matter of fact. So I didn't think I'd be doing an advertisement, but I will say that I've really enjoyed the opportunity to think through this, and the robust amount of information we have in our community just waiting to be shared with people is so important. It's so important.
Jessie also, Jeff says they're having that training. The Talk Saves Lives, if I follow this, in San Marcos this weekend. Wow. And then Jessie mentions in the Q&A about connecting with Head Start. And they have a mental health component for their children. That would be an amazing connection with the cohorts themselves, wouldn't it? That would be an amazing connection. Much like Justin talked about with the congregations connecting with the schools in that geography, then to also find out the Head Starts that are in that same geography and making that connection. So yes, Jessie, help us make those connections. That would be really good. It also says Shirley will be joining the North Texas session tomorrow. So Shirley, you might want to bring it up in there as well. I think Doug is going to be in that session. And so that might be a good time to talk about it. Any other thoughts or questions? I'm trying to follow. I haven't been able to close any of the things on the Q&A, which is just fine, but trying to keep up, right? So give everybody a little bit more time to think. I'm going to go ahead and give some of the closing words just for to be a little bit of the head of the game here, and that'll give people a chance to think if there's any more that they'd like to ask. You can find the recordings of this session on the NAMI San Antonio YouTube channel. If you would like a copy of the slides, you'll be able to find them on the Pathways to Hope website after the conference. So I'm just suggesting everybody go to the Pathways to Hope website after the conference to get recordings, to get slides. After I close this session officially, a post-workshop survey will pop up in your browser. And so conference planners really appreciate and value your thoughts, and this feedback will be really helpful in shaping future conferences. It's required if you're hoping for CEUs from this workshop that you complete the survey that comes up in your browser. So yeah, we got something else here in chat. Let's see what we got. There's the survey. Let's see what Laura has here. Chiming in here so I can just message the host. Oh, we answered the questions. Okay, we're good. Got that one done. All right, let's see if there's anything else happening in Q&A. Recommendation network with the military and veteran chaplain groups. We can do that. It's a really great thing. And you know, if you have some access there, the way news travels best is mouth to mouth, word to word, a trusting soul that hears from a trusted messenger. So if you want to promote that as well, we do have contacts with chaplains, and I don't know if we've had that on our list or to-do list yet. So I'm going to add that. Any other last questions or thoughts? And we might just get done a little early. Anyone? Well, I really want to encourage everyone to attend tomorrow the closing breakout. Let's see if I can get to that on the screen. This is how our Bridges to Care got going this last year. There's a closing breakout time tomorrow after the plenary at 1 o'clock. And the presenters are everyone who shows up. So it's really a conversation about how we move forward on Bridges to Care in San Antonio in particular. It's under the, there's a NAMI track, and then there are 2 different sessions underneath that, and one of them is for North Texas. So when you go into that, you will choose one of the breakout rooms. So if you're interested in going to the one about San Antonio, you choose that one. And I really hope that whoever and others can come, even if they haven't been. So if there's somebody even between tonight and tomorrow that you tell about, and they want to know more or want to hear the conversation, they would be welcome to join us as well. I understand you can register for the conference at any time still and still participate. So I encourage that. We'll be bringing up a lot of things that we've heard in the first 3 sessions and talking as San Antonians about, what are we going to do next? How are we going to raise this to the next level? And some of your ideas and your input have already significantly impacted that. So I hope you all come tomorrow. And I don't think, have I shown this particular group the Bridges webpage?
No, you didn't.
Maybe we need to do that. I might be able to just jump to it. Because I think it's real important and helpful if people know where that is, where they can find information on their own. Because we have put, it's a little fuzzy on my end. Oh, it's clearer now. I don't know whether it's the weather. But this is on the NAMI San Antonio website. That's where the Bridges webpage is. And we've really tried our best, thanks to a lot of Geri's design, but to put things here that you can go to yourself and then be able to print, show other people when you're trying to talk about it. I think one of the best tools here although they're all great, but one that's really helpful, I think, to talk, like the first round of talking, is this one pager. And a lot of hard work went into putting all that we've shared with you in 3 sessions today into one page, but we made it happen. And so I think this is a great one pager, and you can always go to that on the website. The covenants there, the charts we've used. I really, like I say, I encourage you to go there if you're wanting to talk to somebody else or trying to remember what we have talked about. It's a great resource. And we might have one more person. Do you use the NAMI Ending the Silence programs? I don't know if that either. Is that about stigma, Shirley? When you're talking about ending the silence? That's
Well,
a
we
thing.
use a lot of NAMI resources.
Yeah.
I'm not sure. I haven't heard this terminology, ending the silence program. We have a lot of other programs we offer from NAMI, but it may just be because we're in pandemic that they're not able to offer that right this moment. But we have access to everything NAMI, and if it doesn't exist in San Antonio, then we need to get it.
Mm-hmm. One thing that might be helpful to folks in all of this too is that in a way, in a sense, if you're familiar with collective impact and collaborations, we work somewhat in that kind of organizational process. NAMI is the backbone organization behind Bridges. So the administrative, the fiduciary work, all of that falls under NAMI. Even though it's a collaborative, we had to have, somebody doing that. And so NAMI does. And a lot of that work is shared and put into practice. It's, here she says, ending the silence is suicide prevention for schools, parents, and communities. Well, we're going to add it, right, Geri?
Yep.
Yeah, we're going to add it. Oh, stuff just keeps coming. Shirley's busy. I don't know if this is all Shirley, but she's busy. Vicki, I have a faint memory of this being a program National NAMI had for encouraging individuals who had suffered to tell their stories, but I can't remember if it was recorded or written. Hope you both come to tomorrow, but I think Shirley said she was going to the North Texas breakout tomorrow, but we're going to stay in contact with Shirley because she's been sharing a lot.
I've been copying everything down.
Yep, she also says it's been offered virtually as well. So I am going to quick copy. The copying of the chat has not worked very well for me. Can't think of anything else. Any last words that you would like to share, Geri, and then Susan, other than our gratitude?
Our gratitude is big. But what I want to say more than anything is if you're not part of a congregation or organization, still contact me, please. I'll get you involved in Bridges to Care. And we will find a cohort for you. And you don't have to build your own cohort. We can do it. We can find like-minded people in your geographic proximity. And so don't even hesitate. Don't even think twice. Contact me to join Bridges to Care.
Susan?
Yeah, I guess the one thing I'd say is that as much fun as it is for everybody to all hands on deck and everybody to be involved, try to find somebody who's willing to step outside and take a look and communicate it back. Because on an ongoing basis, and all of the surveys come in to my email, my company's email. And so every day when Geri has finished out sending out the emails to people, they start coming in. Some people are in the middle of the night, they're filling this out. I'm amazed. Sometimes I'll, wander in and, get my home computer and my work computer synced up. And there's somebody at 5 a.m. filling out the survey. I really think that if there's somebody who then can kind of shepherd all this to the other participants, it is very important. And also let all the participants know that when they tell everybody how people feel, don't kill the messenger. We'd like to be around for the next round.
And we are so grateful for the messenger. And we're grateful to all of you. It's 3:45. Thank you for today. And we plan to see you all tomorrow. Have a good evening. I'm grateful for the rain.
And take care today when you're watching the news, if you're watching the news. Mm-hmm. We all have heavy hearts right now for our country and for the Afghanis. I'm sorry I had to say it. We have a big world to take care of.
Mm-hmm. No reason to apologize. Thank you all so much. Have great evenings.